another 10 minutes of truth here at Lincoln Disc and Nutrition Center. And today we're going to talk about a subject that concerns a lot of people. It's called carpal tunnel syndrome. And I'm going to talk about an article that came out in November of 2016 in a journal called Lancet Neurology. And Lancet is one of the most prestigious major medical journals in the world. It's from England. And the name of this article is called Carpal Tunnel Syndrome, Clinical Features, Diagnosis, and Management. And carpal tunnel syndrome is one of the most common peripheral entrapment syndromes in the world. And essentially, it's caused by the median nerve that comes through the carpal tunnel area right in here, gets entrapped, gets trapped, and it can cause pain, numbness, tingling, weakness, and all sorts of issues. 1 in 10 people develop carpal tunnel syndrome at some point. The highest prevalence is in women age 60 to 74 years. Now, here's a very interesting statement from this article. It says, there is a paucity of evidence about the best approaches for assessment of carpal tunnel syndrome and to guide treatment of doctors. That just says there is not a lot of good information out there about treating carpal tunnel effectively. It says edema, tendon inflammation, hormonal changes, and manual activity can contribute to increased nerve compression and sometimes cause pain, as in the case of tendon inflammation. Risk factors of carpal tunnel include diabetes, so elevated blood sugar, which we know causes inflammation, menopause, hypothyroidism, which can cause inflammation, obesity, arthritis, and pregnancy. So I've seen in my practice here in Nebraska, I've seen a lot of the people that have carpal tunnel syndrome are obese. They're overweight. And that causes, a general widespread inflammation, which can spill over into the wrists. So carpal tunnel syndrome can be localized in this area with pain, numbness into the hand, or it can actually spread up the arm and into the shoulder. And one of the problems, or I would say things that can be confused with carpal tunnel, is what's called cervical radiculopathy, which is nerve compression of the nerve root that comes out of the neck, which can cause symptoms similar to carpal tunnel. The difference is that it will be exacerbated sometimes by rotation or flexion, extension of the head, which if it's a true carpal tunnel down here, that won't happen. Now, there is a syndrome in healthcare called double crush syndrome. And what that means is that you have a problem here at the level of the nerve root and a problem here at the carpal tunnel syndrome. So there's two areas that are causing or contributing to the dysfunction. They get into treatment in this article, which is really interesting. One of the things they recommend, one of the things that they said that can help is low-level laser therapy, which I do in my office, and it can be very, very effective. Therapeutic ultrasound is another thing that they mention here. Musculoskeletal manipulation is widely used. We also use that. I will evaluate and adjust carpal bones in the wrist. And a lot of times that can relieve carpal tunnel syndrome. The use of splints can be very, very helpful to take pressure off the carpal tunnel. They said that in this article, surgical treatment should be the treatment of last resort, and that surgical complications of carpal tunnel release are reported to occur in 1 to 25% of patients. Well, that's a huge spread. I mean, that's, I don't know where they got that, but that's quite a spread. Another treatment that I found that works really well for carpal tunnel is something that I've been doing the last year and a half called stim pod, and it's actually a regeneration. It's an electrical impulse that actually regenerates nerve function, and we found that to be very, very effective for all kinds of problems. And in carpal tunnel, it may have to be done, multiple times for it to work, but stim pod is very, very effective for neurological denervation or neurological disorders where the nerve function is being impaired. So I would tend to want to use musculoskeletal manipulation, low-level laser, and stim pod. Those are my choice methods for dealing with carpal tunnel, and I found them to be generally pretty effective. I haven't found surgery to always be the most effective thing for carpal tunnel. Sometimes it'll get rid of the pain, but the patient still has very, very weak grip strength. So there's some payoffs for that. So I would recommend conservative care, chiropractic care, laser, and stim pod. And if those things don't work, along with maybe using a splint, then maybe you might want to consider surgery. But I would not do that immediately because, once surgery is done, you can't go back and undo it. What's done is done. And this article said that usually after surgery, the average time where they have to go back in and do surgery again is 31 months. So that's just over 2 years. So, in 2.5 years, you're looking at possibly another carpal tunnel surgery. So I would be careful about that, about jumping into surgery, and try some more conservative care. So we do that at our office. And if you have carpal tunnel and you'd like to try a more conservative approach, we do that here at Lincoln Disc and Nutrition here in Lincoln, Nebraska. And you can call us at 402-488-2220. Just give us a call. We'd be glad to take a look at you. Other than that, I hope that that this article gave you some information you didn't have before. And we will see you next Wednesday for another edition of 10 Minutes of Truth.